Let's do the reproduction 2 warm-up. First question, what are the common side effects of beta blockers? So they can cause bradycardia, possibly cause some AV block. They depress myocardial contractility, so they might trigger some CHF. The non-selective beta blockers can cause bronchoconstriction, and beta blockers can mask the sympathetic symptoms of hypoglycemia. Next, describe how the murmur of mitral regurgitation is different from the murmur of aortic regurgitation. So the murmur of mitral regurgitation is holosystolic. It's heard throughout systole. It's heard loudest at the apex. It's heard best in the left lateral decubitus position, so you have the patient lying on the left side. And it's going to be enhanced by maneuvers like squatting and also by expiration. Then aortic regurgitation is a diastolic murmur, which is heard in the first part of diastole. It's usually heard best along the left sternal border, and this doesn't really have anything to do with the murmur, but remember that aortic regurgitation is also associated with a widening of the pulse pressure. And the last question, in which order of elimination, zero order or first order, would you see a linear decrease in the plasma concentration of a substance when plotted against time? Well, that's zero order, because in zero order kinetics, the rate of elimination of the substance is independent of the level of the substance. All right, now we're ready for the lecture.
Hello everyone, and welcome to our video on genital embryology. In the last video, we talked about reproductive anatomy. Now let's talk embryology. The embryology of the genitals is about a 4-star topic. You'll more than likely have a question on this. First, let's talk about the development of the kidney. We have 3 important structures: a pronephros, which degenerates early, and a mesonephros, which acts as the embryonic kidney for the first trimester, then degenerates, and a metanephros, which eventually becomes the adult kidney. But that mesonephros, that middle one, that eventually degenerates, it has a fully canalized duct system called the mesonephric duct. And right alongside that, you develop a paramesonephric duct. With me so far? The mesonephric duct, which is also called a Wolffian duct, is going to degenerate sometime after the first trimester. It's going away unless something induces it to stick around. And the something that would induce it to stick around and develop is testosterone. We'll talk about where that comes from in a minute. But for now, just remember that the mesonephric duct can become male genitalia under the right circumstances. So remember, mesonephric duct or Wolffian duct plus testosterone equals male. The paramesonephric duct is also called the Müllerian duct, and this will go on to become the female genital tract unless something inhibits it from doing so. The default developmental program is for the mesonephric duct to recede and the paramesonephric duct to develop into female structures. So remember, paramesonephric duct, also known as Müllerian duct, plus nothing equals female. Now, if you have a hard time remembering which is the mesonephric and which is the paramesonephric, think about this. The difference between the word man and woman is the prefix wo. The difference between the word male and the word female is the prefix phi. And the difference between the word mesonephric and paramesonephric is the prefix para. So the female always gets the prefix woman, female, paramesonephric. Pretty easy. And remember, the female pathway is the default. You have to induce the mesonephric ducts to make man parts. You don't have to do anything to induce woman parts. In fact, you have to inhibit the paramesonephric ducts from developing into a uterus. Let's talk some more about female development. The paramesonephric ducts develop into the fallopian tubes, the uterus, and the upper portion of the vagina. Let me repeat that. The paramesonephric ducts develop into the fallopian tubes, the uterus, and the upper portion of the vagina. What about the lower portion of the vagina? The urogenital sinus gives rise to the sinovaginal bulbs, which will eventually develop into the lower portion of the vagina. So again, the urogenital sinus develops into the sinovaginal bulbs, which proceed to develop the lower portion of the vagina. So what if you have a problem with the development of your paramesonephric ducts? Can you still have a vagina? Well, you might end up with something called vaginal agenesis or atresia, which is also called Müllerian aplasia. This is a congenital absence of the vagina. And as the name implies, it results from an agenesis or hypoplasia of the Müllerian duct system. There can also be agenesis or atresia of the lower vagina as well. This occurs from abnormal development of the sinovaginal bulbs and vaginal plate. Let's look at some other things that can go wrong with the paramesonephric ducts for just a second. The ducts are supposed to come together and fuse to form a single uterus with a single uterine cavity, but things don't always go according to plan. If the two paramesonephric ducts don't fuse correctly, you can get something called a bicornuate uterus, which can lead to infertility and recurrent miscarriages because there's simply inadequate room to grow. So if the female program is the default, what does it take to make a male instead? Who's calling the shots? Who's the decider? Well, it turns out that the decider is a gene called SRY, which is found on the Y chromosome, which makes perfect sense since only males have a Y chromosome. The SRY gene codes for something called testis determining factor, which induces the undifferentiated embryonic gonads to become testes and to develop 2 specific cell types and 3 specific hormones. The Sertoli cells make a hormone called Müllerian inhibitory factor, which, as you might guess, inhibits the Müllerian ducts, or the paramesonephric ducts, from becoming a uterus, fallopian tubes, and the rest. If Müllerian inhibitory factor is around, the paramesonephric ducts are going to degenerate. The second cell type, the Leydig cells, produce the second hormone, testosterone, and testosterone is what stimulates the mesonephric or Wolffian ducts to become all of the internal male genital structures, the seminal vesicles, the epididymis, the vas deferens, all those things that sperm travel through except for the prostate. That develops with the external genitalia for whatever reason. So that's 2 cell types and 2 hormones. For the third hormone, think back to endocrinology and the adrenal steroid synthesis. There's an enzyme called 5-alpha reductase that converts testosterone into dihydrotestosterone, or DHT, which is a super potent form of testosterone. And that DHT is responsible for inducing the urogenital sinus and the genital tubercle to become the male external genital structures. What did that urogenital sinus become in the female? Remember that it became the lower portion of the vagina. So DHT is very important because without it, there could be ambiguous external genitalia. Okay, let's see if we can piece everything together in a Dr. C recap. First, let's look at males. Paramesonephric duct is inhibited by Müllerian inhibitory factor. Mesonephric duct is stimulated by testosterone to produce internal male structures, including the seminal vesicles, epididymis, vas deferens, but not the prostate. 5-alpha reductase converts testosterone to DHT. DHT stimulates the urogenital sinus and the genital tubercle to develop into external genital structures. Next, let's review females. Paramesonephric duct develops into fallopian tubes, the uterus, and the upper portion of the vagina, since Müllerian inhibitory factor is not present. The mesonephric duct degenerates because of lack of testosterone, and the urogenital sinus develops into the lower portion of the vagina because of lack of DHT. There are 2 developmental penile anomalies to discuss, which are hypospadias and epispadias. Both of these refer to the positioning of the urethral meatus on the penis. Hypospadias is where the meatus opens up on the ventral aspect of the penis, which is much more common and is more of a cosmetic problem. It can be surgically corrected by a pediatric urologist using a little flap of foreskin. Surgery may not be necessary with mild hypospadias, but surgical correction with severe hypospadias is common. Epispadias is where the meatus opens up on the dorsal side of the penis. This is more severe because it's commonly associated with something called exstrophy of the bladder. Let's look at that in the study guide. Exstrophy of the bladder is a congenital gap in the anterior bladder wall and the abdominal wall in front of it, so that the interior of the bladder is open to the outside world, and that needs to be repaired as well. So let's talk about external genitalia. The male external genitalia have specific homologous counterparts in the female and vice versa. These male-female genital homologs are another high-yield topic, about 3 stars, possibly 4 stars. The glans penis in the male is homologous to the glans clitoris. The corpus spongiosum and the corpus cavernosum, which cause erections, are homologous to the vestibular bulbs. The bulbal urethral glands, or Cowper glands in male, are homologous to the greater vestibular glands, or Bartholin glands in females. And as a side note, the Bartholin glands can become infected, leading to the development of an abscess called a Bartholin gland cyst. To treat this, you have to open it and drain it. The prostate gland is homologous to the urethral and paraurethral glands, the Skene glands. The ventral shaft of the penis is homologous to the labia minora, and the scrotum is homologous to the labia majora. The very last topic I want to cover deals with how the testes and ovaries descend. There are 2 structures to be familiar with, the gubernaculum and the processus vaginalis. In males, the gubernaculum is what anchors the testes within the scrotum, and the processus vaginalis forms the tunica vaginalis, which is one of the coverings of the testicle. In females, the gubernaculum becomes the ovarian ligament and the round ligament of the uterus, which anchors the uterus to the labia majora. The processus vaginalis is obliterated in females. All right, that's it for the lecture. Let's have a go at the end of session quiz. First question, what structures develop from the mesonephric duct system? All of the internal male genital structures except the prostate. This will include seminal vesicles, epididymis, ejaculatory duct, and vas deferens. Next, what is the male homolog to each of the following female structures? Vestibular bulbs. The male homologs are the corpus spongiosum and the corpus cavernosum. Labia minora, the homolog is the ventral shaft of the penis. Bartholin glands are homologous to the bulbourethral glands. Urethral and paraurethral glands are homologous to the prostate. Next, what gene product comes from the SRY gene that underlies male genital development? The SRY genes codes for testis determining factor. Next, what structure anchors the testes to the scrotum? That's the gubernaculum. That's the end of our video. I hope you learned something. See you next time.